one of the highlights of our presentation was just making, increasing awareness of how common domestic violence is in the community. So there are, depending on the survey, depending on the country, but in the US, 1 in 4 women have experienced intimate partner violence at some point in their lives, which is really high. Well, the first thing is to acknowledge that right now there's no mandate for universal screening, so people are not asking, and it's like the type of thing that you don't know until you ask, right? So I would say the biggest barrier probably is that we don't know, and when we're as clinicians or mental health professionals, when we're interacting with people, we're not typically asking about these things. And there's no, of course, if there's physical abuse, you might see signs of physical abuse, but that's not necessarily the case for the vast majority of people. So I would say we are in mental health in a very privileged and position, and we have a great opportunity to actually screen for that. We do know, and the World Health Organization does acknowledge that for mental health professionals, it would be good clinical care to ask, because it would have repercussions in terms of what we see, the symptoms that we see, and things will make more sense, and we will know what to do with them better if we knew that there's violence behind all these symptoms, right? So I typically say, I now and then interact with people who had never disclosed the violence or the abuse that they were experiencing before, and when receiving diagnoses that were really misunderstood, because if somebody's getting threats constantly from a partner, if they're scared for their safety, then I would hear people complaining of things that were quoted or reported as hypervigilance or psychosis or paranoia, when it made so much sense that these people were very afraid of, for their safety. So I would say for us, it makes a lot of sense, and I would say the main step would be to make sure that we're screening, that we're asking people about this. Then another, recommendation that comes out of the talk today is it's a very complex problem. A lot of women or men who are in abusive relationships are not able to leave or don't want to leave the relationship, right? And that doesn't mean that they're not, that they're not going to find our services very helpful. So it's important to assess, their safety, understand that not everybody's ready to leave, that sometimes there are safety concerns and reasons why they can't leave. So that since the problem is really complex, it really requires a team to work to address this complex issue. So for psychiatrists or therapists, making sure that you're not working in isolation, that you have a team, or you're working with an agency that has experience dealing with this type of issues. For people who need emergent housing or who are really needing resources to be able to leave the relationship, all of this makes sense. You really need to work in a team.